Thank you, Guðberg. Can you hear me? So, like you probably have figured out by now from my name, let's see if we can get the slides up. I am Icelandic, but I have to admit that this is my first time here at UTMESSAN. But there's a good reason for that. For the past 10 years, I've been living abroad. I moved to Aalborg in 2008 to study. And since then, I've been living in Copenhagen for the past 2 years with my girlfriend and leading the business development unit for MEDEI. I have 8 years of experience working with medical software and healthcare data, both at the university level, but also within the industry. And like Guðberg mentioned, early 2013, I founded the company MEDEI. At MEDEI, we are experts in healthcare data and medical software. And currently, we are servicing clients within the industry and research units, mainly in Europe and the Middle East, who are using our software and solution and services all around the globe. So before I dig into the details of my talk here today, the 3 principles that I'd like to share with you, the 3 do's and don'ts, I'd like to tell you a short story about how I got to know the industry and what really ignited my passion to wanting to improve the way we perceive medical software, but also how we manage and protect healthcare data. So back in 2010, I was a student at the university, and I don't know if you remember, but 2 years earlier there was a big financial crisis here in Iceland, and living off the Icelandic currency in a foreign country was a little bit difficult for a student. So I ended up getting 2 jobs. One of them was at a private clinic that was actually managed by my now co-founder, who is a physician. And in that clinic, I got to experience how difficult it is to manage and collect data, primarily within clinical trials. I was a data entry specialist, and I learned firsthand how comprehensive such a project can be. The other job I had was a little bit more interesting because I was approached by a professor at the university that didn't have a lot of money, and they had planned a fairly big project with the industry and research actors to come up with a software solution that could help rehabilitate patients. So she hired me and my colleague, because we were cheap labor, to develop this software for them. What I realized at the time was that even though they were the experts, they were hiring me because I was the only one that really knew how the technology worked. I was the young guy, I was the software tech guy. And I remember specifically that one day, a couple of weeks before they were supposed to launch the project, she approached me and said, "Jón, before we can start, we have to get an approval from the government, the ethical committee, as it's called, that we're protecting the data well enough. And you need to write that. You need to make sure that we do it correctly." Me being a student and not really aware of what I was getting into, I just said, yes, I'll figure it out. Ended up writing a couple of pages about how we protected that data. What I realized is that the professionals within the healthcare industry, they of course don't have that certain IT knowledge to deliver that information. What I also realized is that the patients that were involved in that particular project, they were also unaware of how this data was managed and collected, the data and the information that they were generating in that project. And for myself as an IT person, it was difficult to me to figure out what was right and what was not right, and what standards existed within the industry that could help me achieve this purpose. So if you fast forward to today, a lot of things have changed since then. The technology has improved quite a lot. The GDPR has forced a lot of companies to follow a little bit different approach towards data processing and management. But the question still remains, how do we go about protecting healthcare data, especially when we're talking about cloud technology and cloud infrastructure? I have to say that there's no definite answer to that question, because healthcare data is quite complex. But what I'd like to share with you today are 3 principles, the 3 do's and don'ts, that I have identified within our organization to be the main drivers towards our success. So before I dig into the 3 principles, I'd just like to make sure that we're on the same page on what healthcare data really is. Healthcare data, in general, can be categorized into 4 elements or categories. First of all, we have what's called clinical research. This is the data that is usually generated from early testing of medical products, medical devices, treatment methods, and so on. This is the foundation of our healthcare system. Everything we do in regards to treatment and diagnosis of diseases is driven by the information that is gathered and scientifically proven within clinical research. The second category is the category of healthcare records. This is the data that is generated at hospitals, at private clinics, etc. This is more of what you would call the operational data of the healthcare system. The third category is a little bit newer compared to the others. This is the data that is generated primarily by ourselves, by the smart devices that we have, the smart watches, the smartphones, our running tracking devices, etc. It's believed that these data somehow are not healthcare data, but as personalized medicine becomes more and more advanced, this is the data that's gonna drive the treatment processes in that field. The fourth category that is often forgotten is the category of pharmacy information. This is the information and data that is generated when we buy medicine, when we use medicine, and so on. So all of these 4 categories, they have 5 things in common. There are 5 unique characteristics to healthcare data that we have to make sure to cover before I go forward. The first characteristic of healthcare data is that it's quite scattered. It's found everywhere. It originates from hospitals, from people, from general practitioners. It's everywhere. There's no one place where you can find healthcare data. The second characteristic of healthcare data is that it's evidence-based. It's constantly changing. The definitions of the information that we use, the types of variables that we use during treatment are constantly changing. And this is mirrored in the way we manage it and perceive the data. The third characteristic is that it's both structured and unstructured. You can find very well structured data sets in the healthcare system. On the contrary, you can find non-structured data sets in other countries or in other type of systems. And this makes it quite troublesome to access, because you would think that all hospitals or all countries have everything figured out, the way they structure and they manage the data, but it's actually quite the opposite. It's very different from one country to another, and even one department to another. The fourth characteristic is that it's quite complex. And what I mean with complex is that you often need a certain level of knowledge to understand it, but also to utilize it. And this knowledge is often not found within IT companies. This is the knowledge of the physicians, of the healthcare professionals. And lastly, the most fun characteristic of them all, there are some very serious regulatory challenges, especially for IT vendors within this area. We have regulations that govern privacy, and on the other hand, we have regulations that govern healthcare systems. and it can be quite difficult to figure out when which regulation governs the other. So how do you go about approaching this part of the industry? Well, in our case, we wanted to deliver a disruptive solution for clinical research. We had a vision for a SaaS solution, software as a service solution, that was quite different from what you otherwise saw in the industry a couple of years back. The standard in the industry was, and still is, quite a lot of locally hosted solutions that are implemented with special hardware around hospitals or other facilities in the healthcare system. But we wanted to disrupt that part of the system and try to provide a more cost-effective solution, because software as a service back in 2014 was not just beginning to become popular, and at the time it was totally unknown of within the healthcare system. So the essence of a software as a service solution is its infrastructure. And apart from all the requirements or the use cases that we wanted to fulfill for our clients in our solution, we had some internal requirements that we wanted to make sure that we would be able to fulfill. We wanted to make sure that if we were going to go and do this for real, we had to be up to modern standards in regards to performance and availability. Fast, accessible, everywhere. We wanted to make sure that the infrastructure that we chose for our solution would live up to the modern development practices that we had in-house. So our company is quite young. I think the average age is around 25. And we use modern tools. We use the most high-tech testing, deployment tools we can find because we like it. We don't want to go old school. So we had to make sure that the infrastructure that we chose for our solution would be able to support that. We, of course, had to make sure that the infrastructure we chose would live up to the compliance and the quality assurance standards that we had to fulfill in regards to hosting of the data. It had to be cost efficient. It had to mirror the price that we wanted to put on our services. And lastly, the usability and accessibility of the software had to be just like we're used to in any other industry. We wanted to bring Facebook speed, or any other modern software as a service application speed into the healthcare system. So with these requirements in mind, we decided to go with a cloud technology infrastructure. And there are basically 4 things that drove us towards that path. It gave us the performance and the scalability that we were seeking for. We suddenly were able to buy the services for performance and scalability at hand. It allowed us to live up to the modern development and deployment practices that we wanted to keep up within our organization. It enabled ease of implementation in regards to especially hardware for our clients, but also for ourselves. And of course, there's almost no maintenance cost for us. We didn't have to hire a hardware IT person to take care of the infrastructure. So with us as a small company, this was quite interesting for us to do, because we knew that by going with cloud technology infrastructure, being a service provider and a vendor within the healthcare system, we were going to raise some questions. And one of the most popular questions that people raised was, where's the data going to be located? Is it secure enough? And how do you control access to my data? People perceived the cloud being something that was up there, and as soon as data gets uploaded into the cloud, it scatters. This is something that we've learned from the media, from companies that have failed to deliver their services within the cloud, and it scares us. And I completely understand that. But what we realized is that these questions weren't being addressed because people were afraid of us or afraid of trusting us. They were questioning the cloud in general. And the reason for that was because they believed that there were some myths about how it worked that weren't in line with the actual regulations in play or the actual technology that was being used. Which leads me to my first principle. The first advice I'd like to share with you is don't be fooled. Read the regulations. It might sound obvious at first, but reading the regulations that you have to comply with can be a tough thing to do. Usually it's just something that we hire our lawyers to do, and then we listen to them. However, when you're providing a new solution to an industry that is quite locked up, I'd say, they're hesitant, they're driven by clinical evidence, they want to believe that you've proven something before they buy something of you, you will receive negative feedback to begin with. People don't like change. So we had a lot of people coming up to us and advise us against using the cloud. And localization was one of the biggest debates. People were afraid that the data would be scattered everywhere. But we figured out there was a huge mismatch between what actually was allowed within the regulations and what people believed. So the best thing that we did to begin with was to actually read and understand the regulations that we have to comply with. We gathered ourselves an overview of the requirements that we had to fulfill as a vendor and what our clients had to fulfill as a client. We came up with an internal plan of how we wanted to approach these challenges in terms of localization, processing, informed consent, and so on. And then we sought legal advice. Because if I would have walked up to my lawyer before, he would probably have suggested that I did something totally different. But because we'd already did the due diligence of the work before, we were able to spar with our legal advisor a lot better. And then we managed to apply our solutions into practice. What that results in is a lot better understanding of the whole regulations at play, but also a lot better communication internally and externally. Second advice, don't hide your work. Be transparent about it. So software is an industry that's a lot driven by trying things out, R&D, developing, implementing. And what that often results in is lack of documentation. I don't know a single developer that writes everything down and documents everything before he sits in front of the computer. People want to try things out first. Documentation is usually the second thing you'll do. But what that results in is lack of understanding of how you're implementing things, how you're fulfilling the requirements that you have to comply with. What that also results in is that you'll have a lot longer or prolonged sales cycle, confused clients, and unsecure sales and marketing team, because they also lack the understanding of how you did things, how you implemented this and that. So when a client asks you, how did you handle that localization problem? Your sales team has to, get in touch with that guy that figured that out and then come back to them. That results in weeks and weeks of email instead of having that documentation ready and sharing it with them. So what you have to do is to be transparent about it. Find a standard that you can lean up to. Document your work accordingly to that and share that documentation, not only internally, but also externally. What that results in is that you'll have a lot better structure and overview of how you're doing things internally. You have an improved quality assurance. You have a lot more added value to your sales and marketing teams, and you'll gain trust of some of your clients because you're able to show that you're following a certain standard versus somebody else that's not doing it. The second thing that we did in relation to this was to be open about it. So we started educating people. We educated our clients, we educated our internal teams. We wrote a statement on our website that explained everything about how we handled the security of our system. I remember I wrote 14 pages originally, put it online, and then I just linked it with everybody that needed to address some questions about our security or how we did process their data. We started publishing blogs and white papers about it because we wanted to be perceived as the expert within the area that we were working within. The third principle, the last advice I'd like to share with you today, don't go solo. Try to partner up. Because in healthcare, recognition is everything. This industry is driven by science and clinical evidence. And if you don't have tangible references or recognition to back you up, if you're just a small IT company, 20 people, it's going to be tough because trust takes time. And if you have the capital, okay. If you don't have the capital, you will need to figure out a way to speed that process up. Because documentation alone is not going to buy you references. So what we did is that we sat down and we decided that we needed to define a partner strategy. We needed to find somebody that could help us, give us that recognition. We realized that the perfect partner for that job was our own cloud technology provider. In your case, that could be somebody else. It could be an advisor. It could be a partner that is already in the market and is selling a similar service. It can be an investor. It can be anything else. In our case, it was our own provider because they had a known name within the industry. And people put trust in them. We got enrolled into a special program that we almost forced ourselves into. We started showing up at these meetings and meetings and meetings until somebody heard about us and gained interest in what we were doing. They managed to help us shorten that sales cycle. They assisted us with the contractual work, which was very delicate when you're speaking to lawyers within the IT and health industry. And they provided us with technical assistance. So all of these three, they helped us gather the recognition that we needed to approach the industry. So let's summarize for a bit. Make sure that you gather as much information about the requirements and the regulations that you have to comply with, and come up with an internal plan of how you'd like to approach that before you seek legal advice. Make sure that not only the QA person has read the regulation, make sure that the operational manager, the developers, the CEO has the knowledge to be able to answer the questions that you might need to answer during a presentation of your system. Be transparent about it. Line up to some kind of a standard that can help you document your work efficiently, but also give you a platform to share that information. Partner up with somebody that you believe can help you shorten the process of approaching clients within the healthcare industry. It's a complex industry, and it requires a lot of money to go solo. It's not about pride, it's all about recognition. With that said, I'd like to thank you for your time, and if anybody in here is within the same industry, I'd love to have a chat with you later, so make sure to connect with me on LinkedIn and catch me outside. Thank you very much.